Hi everyone, my name is Jarna Kukreja and welcome to yet another live at Parentune. Today's session is going to be super interesting because as new parents, all your queries and all your doubts regarding the 6th-week vaccination are going to be resolved. Now, as a parent myself, I can recall and relate to that newborn parent phase where it's an exciting phase, but at the same time, it can be quite overwhelming with lots of first time experiences. And one such important milestone in the journey of parenthood is protection of our newborn through vaccinations at the right time. That's why, when it comes to the first vaccination post discharge from the hospital, we are here to ensure that you call all the right shots and are armed with the best possible information so you are best prepared. Today, with us, we have Dr. Somasundaram to answer all your queries related to the new one vaccine to protect against 6 diseases. This vaccine is perceived as less painful, and our goal is to make you feel fully empowered about your decisions on protection through vaccination. Welcome, Dr. Somasundaran.
Thank you, Jarna. Welcome all the parents who have joined in this live.
Right. So, Dr. Somasundaran is a senior consultant pediatrician in Chennai with over 24 years of experience in this field and with an MD in pediatrics. He currently practices at Sabri Childcare in Kandanchavadi in Chennai, as well as Sabri Childcare Center in Adyar. He's also the co-founder of Be Soul Child Development Center and a visiting consultant at Apollo OMR. Doctor, to start off with, the terminology related to vaccinations is quite new for, especially for new parents, first-time parents. So could you help us in greater detail to understand what vaccinations actually are for a newborn, for a baby, and a little bit about this new one vaccine to protect against 6 diseases?
Correct. So see, vaccinations. We need to be protected against diseases, right? So we have lot of infections around us, and there are infections which can be mild. There are infections which can be life threatening, which can cause severe disease or some deformity in ourselves. So what these all these health experts do, they find out what are the diseases which are life threatening and make up vaccines. So during this COVID era, you must have found that because the COVID is a new infection, they did research, lot of research came up with the COVID vaccines. Likewise, since 1950s onwards or before that, the people have started research on various diseases and they have found out vaccines. This vaccines, what they do is, they when they are injected into the body, they are nothing but they are either, yeah, they are suppressed viruses or suppressed bacteria. When they go inside the body, they produce an infection which is not seen outside, but they produce an subclinical infection that is inside the body but not seen outside. Automatically it produces some antibodies in the body, in your body, so that when the real infection strikes you, you will be protected against uh, the particular bacteria or virus. So that is the way in which your vaccines work. We have vaccines starting from your polio to the latest one, the COVID vaccines. All these are specific disease protected. Not that if you give one vaccine, you are protected against all the diseases. Parents should know that if you give a specific vaccine, you are protected against the disease. If you give typhoid vaccine, you are protected against typhoid. If you have not given or if you have missed the varicella vaccine, your child is not protected against varicella vaccine. So that is the concept of vaccination. And coming to your second question, Jana, that's the vaccine against 6 diseases. See, previously, the diphtheria, pertussis, tetanus. These were called as the triple antigen, or the triple antigen is the DPT vaccine, which we all know. As days evolved, people have started thinking that why don't we combine vaccines rather than giving 3 pricks or 4 pricks for a child? If we combine a vaccine, and make it into a single vaccine, the ease of administration will be easy. The child will need only one prick of all the vaccines. So what they did was they combined this DPT vaccine. Previously used to give DPT vaccine separately. We used that HIB vaccine, that is the brain fever vaccine, separately. The hepatitis B vaccine, that is the jaundice vaccine, separately. And previously we used to give polio drops, but nowadays WHO says we need to give the injectable polio, which is more superior and less side effects than the oral polio drops which is being given. So what happens is we have 6 diseases: diphtheria, tetanus, polio, which is the diphtheria, pertussis, tetanus, which is the triple antigen or the triple disease, and the polio, the HIB, and the hepatitis B. All these vaccines, all these diseases are being covered with a single prick. This is the 6-in-1 vaccine.
Right. Doctor, you mentioned, the reason why combination vaccines were created, and so for the ease of administration as well as so that the baby does not have to face several pricks. Now,
Correct.
when I became a parent, my twin boys are currently 9 years old. So when I
Okay.
became a parent 9 years ago, this one vaccine for 6 diseases did not exist, and
Correct.
we had to take several standalone vaccines for our babies at that point in time.
Exactly.
With regards to the efficacy of the combined vaccines, are they equivalent to how good a standalone vaccine was or is? So, is it equally beneficial for a parent to go in for a combination vaccine as opposed to a standalone vaccine?
See, whenever a company comes with this with a combination vaccine, what they do is they do a study in comparison with the standalone vaccine. Whether the components give, whether the component of the HIB, that is the brain fever, or the hepatitis, or the DPT, diphtheria, pertussis, they produce the same immune reaction or the same immune efficacy whenever it is given separately or whether this is in a combination vaccine. So they do the field survey or the field analysis by doing the sample from all those kids, from a particular sample of kids, and they find that this immune response is the same if they give the vaccine separately or by a combination. That's the way they have found out that these vaccines work in the same way as given as a standalone vaccines too.
Right. So you heard there from Dr. Somasundaram that a combination vaccine will give the same immune response as standalone vaccines would have. Doctor, my next question to you would be if you could just elaborate a little bit more on this one vaccine for 6 diseases, clarify for all the parents who have joined us what all diseases this one vaccine fights against.
Perfect. See, this is the vaccine. You all must be knowing that vaccination starts from birth. We give the BCG vaccine in the the left arm in the upper side. That's the BCG vaccine against tuberculosis. We give a polio drop and a hepatitis B at birth. Then comes the vaccine which is commonly known as 1.5, 2.5, or 3.5, or 6 weeks, 10 weeks, 14 weeks. The parents should know that the 6 weeks, 10 weeks, 14 weeks are the same vaccines which has to be repeated 3 times. This vaccine, if repeated 3 times along with a booster at 18 months, then only you will have an efficacy or a long time protection, as you have seen that this COVID vaccine which we need to repeat 3 times. Likewise, this combination, that is the vaccine combination of 6 diseases, has to be repeated 3 times, because many parents, they have a doubt when they walk into my clinic after I give the first dose. They ask, should I give the same vaccine again at 10 weeks and 14 weeks? Yes, the same vaccine has to be repeated at 10 weeks and 14 weeks, because researchers have found out that the vaccine, if given 3 times, only will produce the perfect response against protection. Now coming to what are the diseases which are being covered by the 6-in-1 vaccine. The first thing, as I already told you, is DPT, the triple disease. D stands for diphtheria, P stands for pertussis, and T stands for tetanus. So all these are the first two are respiratory infections, that is through the air. You get a diphtheria, that is an through the air you get a bull neck or throat infection, some membrane in the throat, that is called diphtheria. pertussis is synonymous with whooping cough. You get a cough which is with a whooping sound. This is called a whooping cough, which is called as a 100-day cough. This is also an airborne infection bacteria. Tetanus, as you all know, it is through the rust or the iron or some spores or the tetanus bacteria which is in the contaminated soil or in the rusted iron and those things. This is the tetanus. So these three diseases are combined. This is way back in few years ago they have found out the combination vaccine of DPT, triple antigen. Then comes the Hib. Hib is a bacteria which can cause a brain fever, which can cause a pneumonia in a child, and it can also cause ear infection. This is the Hib vaccine. Then comes the fifth vaccine, which is the hepatitis B vaccine. Hepatitis B vaccine is a vaccine which is for jaundice. You must be knowing that jaundice can be caused either by hepatitis A vaccine, A virus, or B virus. We have other viruses also, but they are less common. So A viruses are through a foodborne infection. Through a contaminated food or water, you get an A virus infection. But B viruses are through blood and contaminated needles, we get an hepatitis B infection. So that we have a vaccine to prevent hepatitis B infection too. Then comes the last one is the polio vaccine. So polio vaccine, we have two types, oral polio vaccine and injectable polio vaccine. Previously, we sticked on only to the oral polio vaccine. Later, they found out that oral polio plus injectable polio has to be given. Now, they are phasing out the oral polio, and oral polio is only one time in the life, as in the Indian Academy of Pediatrics schedule, that is only at birth. The rest of the polio vaccines are injectable polio vaccine. So diphtheria, pertussis, tetanus, Hib, that is for brain fever, hepatitis B for jaundice, and IPV is injectable polio vaccine. These are the 6 diseases which are being covered in the 6-in-1 vaccine, which is given at 6 weeks, 10 weeks, and 14 weeks.
Right, you heard it there from Dr. Somasundaram about the various diseases that are covered by this one vaccine that protects against 6 different diseases. And this vaccine is given at 3 different times, starting from 6 weeks onwards. Doctor, now there is a lot of confusion in India related to vaccines, and layman, the terminology used by layman is painful and painless vaccines. I remember as a parent, when my children were given the option of 2 DTP types of vaccines, the DTaP and the DTP. So could you clarify for all the parents today, what are there actually, painless vaccines and more painful vaccines? Can you clarify this aspect?
Sure. See, the thing is, parents should understand that any vaccine which is being pricked to the child will leave a pain. There is now no such vaccine that if I give a prick, the child will not have a pain, and that's not that idea has to go out of the parent's mind. The thing is that when the medicine or the liquid which has been injected go there, stays in the muscle which has been injected, produces a reaction in the muscle and produces a response in the muscle which causes 4 reactions, that is a pain, a swelling, a redness in the area, and a fever. If all these 4 things are there, it is called as a painful vaccine or a pain vaccine or a whole cell vaccine. So it means that a whole cell vaccine will cause a pain in that injected area for about 24 to 72 hours, a redness in the area, a swelling in the area, and a fever which may persist for 24 hours. So this is the usual nature of a whole cell vaccine. So parents should know that only one component of this vaccine is supposed to cause these things. We call this 6-in-1 vaccine, and among the 6, only one, which is the pertussis component, is the only one which causes these various responses like pain, fever, swelling, and redness. Because in pertussis we have various antigens. The various antigens are the one which produces the diseases. What they have found out that there are about 3 or 4 antigens which are responsible for the pain, redness, and swelling in the pertussis vaccine. So by using the latest technology, what they have done is they have removed the 3 or 4 antigens from the pertussis bacteria, from the cell wall of the pertussis bacteria, so that when that injection is given to the child will not experience these problems at all. So the parents should know that The rest of the component, that is the diphtheria, tetanus, Hib, hepatitis B, and the polio, are the same in both the vaccines. And only the pertussis component is responsible for all these side effects. And in the acellular vaccine, the whole cell vaccine, the whole cell is there. In the acellular vaccine, few components which are supposed to cause the side effects have been removed by the latest technology. So they are not causing these four reactions which are supposed to be caused by the whole cell vaccine.
Right. Doctor, you mentioned some of the side effects that occur because of the pertussis vaccine. Now, some parents believe that only if these side effects are observed in the child is the vaccine effective. So, if you could give your, expert advice about this, whether they should opt for the painful, so-called painful vaccine because they feel that it is more effective, is this the right decision to make?
Right, you are you have rightly perceived that. See, there are parents who come to me also. I tell them, see, you have a perception that this is the pain vaccine only will give you. So as I already told you, the components are the same. If you say that, what is the only vaccine which can cause a fever and a pain for a long time is the pertussis component alone. The rest of the components are the same in both the vaccines. In pertussis component alone, you have a whole cell, you have a acellular. Rest of the vaccines which are given for the child till 2 years will not cause any pain, or will not cause a pain for the long term or a fever at all. But you should understand that the pertussis component, the needed pertussis components are there in the acellular pertussis vaccine also. And the effects of the acellular pertussis vaccine and the whole cell pertussis vaccine are the same. And the rest of the five components, the diphtheria, tetanus, polio, Hib, and hepatitis B, are the same in both the vaccines. So parents, if they are comfortable with the with spending some few bucks more for the acellular vaccine, and their their pediatrician is comfortable giving that, they can go for the acellular pertussis vaccine.
Right, you heard it there from Dr. Somasundaram that there is no difference in the efficacy of both the vaccines, so-called painful and painless. They both have the same immune response. Doctor, coming back to the sixth week vaccination, it's the first vaccination post-discharge for the baby. So coming back to the 6 week vaccination, now we've introduced this one vaccine to cover six diseases. In addition to this, is there any other vaccine that is given at the 6th week vaccination? Is there any optional,
Correct.
mandatory or optional vaccine for newborns?
See, first thing, you should understand that we have only two schedules in India. One is the Universal Immunization Program, that is the UIP schedule, which is by Government of India, which is being followed in primary health centers, government hospitals, and government medical colleges. That is the UIP schedule. The second schedule is the Indian Academy of Pediatrics schedule, which is the national body of all the pediatricians of the country, which as on date has around 40,500 pediatricians. They have a committee which is called the ACVIP, that is Advisory Committee of Vaccines and Immunizations in Practice. ACVIP, or the IAP Committee on Immunization, they decide what vaccines has to be added, what schedule has to be changed. This will be followed by the private pediatricians practicing all across the country. So we too follow the ACVIP schedule that changes annually or once in 3 years according to the need of the vaccine introduction, or any new vaccine has to be introduced, or any vaccine which is the schedule has to be changed, or doses has to be modified. They decide and they come out with the guidelines every year or once in 2 years. So there is no such vaccine which is called as an optional vaccine or the parent has to decide. We have a chart which says this vaccine has to be given at this month. It is the duty of the pediatrician to recommend the vaccine to the parent, and the parent, as per his thoughts or as per his financial status, can decide on whether he has to take the vaccine or not. I cannot say that this is an optional vaccine, so you can decide or not. because I cannot say your child will not get chicken pox. I cannot say your child will not get typhoid. So, but chicken pox vaccine, hepatitis A vaccine, and typhoid vaccine are not part of the government schedule, because they are diseases which will not kill the child. They are diseases which can cause mild disease only. So government always will think about vaccinations which will cause major problems in the childhood. So those vaccines only will be included in the government immunization schedule. So the thing is, there are no vaccines, as I told you, no vaccines which are mandatory, which are optional. This is a chart which has to be followed. These are the vaccines which are to be given to any child born in India by a private practitioner. So coming to the 6 weeks vaccination, as I already told you, we have a 6 vaccines, that is diphtheria, pertussis, tetanus, polio, brain fever, and hepatitis B, that is jaundice. The rest two of the vaccines in the 6 weeks are, one is the PCV vaccine, that is the pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine is for protection against the pneumococcal bacteria. Pneumococcal bacteria, which is very commonly known by the public as pneumonia vaccine. So this also causes brain fever and ear infection, this pneumonia bacteria. The other vaccine is the rotavirus vaccine. The rotavirus vaccine, why it was introduced means, previously we used to get lot of diarrhea cases. Many viruses can cause diarrhea, but rotavirus diarrhea is the severest diarrhea in childhood, the newborn period. Once a child gets a rotavirus diarrhea, even it can pass 30 to 40 times of loose stools per day, and the child invariably has to land up in the hospital taking IV fluids. After the introduction of this vaccine, this number of rotaviral diarrheas have come down, but there are viruses and bacteria which can cause loose stools, but the severity is less. So only this rotavirus vaccine has been included in the schedule. So how many diseases are we covering in the 6 weeks? We are covering 8 diseases, including the 6 plus pneumococcal vaccine plus the rotavirus vaccine.
Right, doctor. So you heard it from Dr. Somasundaram. In addition to the one vaccine to protect against 6 diseases, the 6th-week vaccination schedule also recommends for another vaccine to protect against pneumonia, that is the pneumococcal vaccine, and one for rotavirus. Doctor, when it comes to this new one vaccine that protects against 6 diseases, since it's such a new introduction into the immunization schedule, um, for the benefit of other parents, could you tell us if other countries are also following this and have adopted this vaccine?
Yes, see, immunization is part of the schedule by all the countries. There are lot number of countries which are using the acellular component vaccine. There are few countries which are using the whole cell vaccine, but the numbers are more with the acellular vaccine, because the side effects to the kids are less. The reactogenicity or the febrile episodes are less with the acellular vaccine, and a lot of countries have adopted in their schedule, the national schedule or the private schedule, the acellular vaccine into the immunization schedule.
Right. Doctor, now coming to any vaccination for a newborn baby or a young baby, what are the do's and don'ts that parents should follow post vaccination?
See, post vaccination, the parent should understand that we are giving a bacteria or a virus into the child's body. It is the suppressed form of the bacteria or the suppressed form of the virus which is being given into the child. Every child is unique. Every child will react to the vaccine in a different way. We say that, okay, no, this vaccine will not cause fever, but there are many instances when a child, among 1 in 1,000 child or 1 in 200 child, may develop an episode of fever. For this, that parents should not get panicky. If they have a paracetamol or a fever medicine with them, as per the weight of the child, the dosage of paracetamol can be given. If the doctor can be reached, or the next day the doctor can be reached, you can consult the doctor why this fever occurred, or if the fever is continuing, they should consult the doctor. And there is no restriction of food and no restriction, you can keep the child comfortable. And if there is a big pain, if the child is complaining of pain or a swelling in the injected area, because every child reacts in a different way, and you are getting a prick into the thigh, So the invariably the child will have a pain, the child will have, okay, next day the walking will be difficult for the child. So you can give a dose of paracetamol which is not going to affect the immunogenicity or the efficacy of the vaccine. If there is a need, you can keep some ice cubes on the area where the child will also feel comfortable. There is no need for avoiding a bath or avoiding some food restriction the next day. Whatever means, these are the questions which parents ask me after giving the vaccination. Should I avoid any food? Should I give avoid sending him to school next day, or should I avoid a head bath the next day? So these are not things that are not warranted with after a vaccine, because kids, it's all the routine part of the kids vaccination schedule, and they are all time tested vaccine, and a lot of studies have been done on kids before this vaccine comes to the market.
Right. So on that note, Doctor, we'll start taking questions from parents. Our first question is in fact related to what you just spoke about. This question comes in from Ananti. Ananti says, "Hello, doctor. My cousin's baby is currently 7 weeks old. Can she give any medicine to the baby beforehand to avoid pain and fever caused due to vaccination?"
Okay, Ananti. So this is a query in every parent's mind, that before my child gets the vaccine, the child should be fever free or the child should be pain free, so that when the doctor gives the vaccine, the child will not experience a pain and those things. I would say there is nothing called you should give a medicine to the child and then come to the doctor's chamber to get the vaccine, because see, the pain may be of mild severity. Why you want to give the dose beforehand? Because whatever the dose, it is going to work for 4 hours or 5 hours only. If the really the child gets the pain after the vaccine, we have seen lot of happy children. Happy children, we may say, oh, take the vaccine, get the paracetamol with you, keep it everything with you. But there may be instances the parent comes next time that, no, sir, the child did not experience any pain at all. The child was so comfortable. The child was playful. The child had the feeding. The child had the good sleep. Then in such situations, there is no need of any medicine at all. So you can avoid giving a medicine to the child. So as per my recommendation, there is no thing called prophylactic fever medicine or pain medicine before taking a vaccination.
Right. Our next question comes in from Shraddha Rajmohan from Delhi. Shraddha says, "Hello, doctor. My baby is 6 weeks old. Is there any painless vaccine, an alternative of this vaccine? Any painless alternative of this vaccine?"
Hello, Shraddha. What I can understand is you wanted to give a vaccine to your 6 weeks baby, right? So as I already discussed, the pertussis component vaccine, the whole cell vaccine and acellular vaccine, these are the two vaccines available in the market. A whole cell vaccine will definitely give a pain, fever, swelling, and redness for the in the area where it has been injected, but the severity will vary from child to child. There may be instances when the pain will be very severe. There may be instances when the fever shoots up to 1 or 2, but not all the children will experience the same severity symptoms. But in the acellular vaccine, it is the reverse. There, if 99% children experience the symptoms, 1% will not have the severe symptoms. Here, 99% will not have symptoms and 1% may have mild symptoms. So it's better, if you want to your child to smile after the vaccine and to not experience the pain, it is better you go for the acellular component vaccine.
Right. Doctor, our next question comes in from Manisha Kelkar, also from Delhi. Manisha says, "My baby is going to be 6 weeks old tomorrow. Can I complete this vaccination and get it administered tomorrow itself?" So, doctor, related to this question, if you could also elaborate on the exact timeline, if a child turns 6 weeks, should they be vaccinated on the same day or during that week? How does it work?
Correct. See, dates are, what I say is an arbitrary one which we mentioned there, right? A baby born on, suppose it's on March 1, we calculate 6 weeks. 6 weeks is exactly 42 days. So we calculate 42 days. Previously, it was told as 1.5 months, 2.5, 3.5. So that is 45. So you can take the vaccination. We in private sector we mention at 6 weeks. That is on the 42nd day we give the date for the first vaccine. Probably if any by any chance if the parent is not available on the day, or if the child is having a mild cold or a fever on the day for some reasons, the vaccine cannot be administered for the child. So you can take your own time once the disease once the illness gets over, or if the availability of the parent or somebody is available, there's no harm in taking the vaccine 2 or 3 days later. But you cannot take a vaccine beforehand, because I am my parents my parents are not here. They are going home. Nobody to take my child to me to take the doctor. So can I take the vaccine 2 days before? No, it cannot be done. Similarly, the next vaccine, the 6 weeks I have given on 42nd day. The next is the 10 weeks. 10 weeks means it is exactly 4 weeks. 4 weeks from that particular date. That means that 28 days. I should take the vaccine after 28 days only. Probably about 3 or 4 days. If any chance you wanted to postpone it, you can postpone it by 3 to 4 days. And by chance I need to travel, how many days earlier I can take the vaccine? If that vaccine is taken 2 days beforehand also, you can take the vaccine. If by some reasons you have not checked the date and it has been given 2 or 3 days before, then that dose becomes invalid. You cannot consider that as the dose, and you have to repeat the dose. So the maximum duration, the minimum duration has to be at least 25 to 26 days, and it cannot be less than 28 days between two doses. And you can postpone it by 2 or 3 days if availability or some other reasons are not making you available with the doctor.
Right. Thank you for that, doctor, because I think that's a aspect that a lot of parents require clarification about. Our next question comes from Ria Singh, who has joined us from Bhopal. Ria says, "My baby is 6 weeks and 4 days old. Please share the side effects of this vaccine."
Hi, Dia. So we discussed about there are 8 diseases which are being covered at 6 weeks, correct? And those 8 diseases we give are given as two pricks. One is the 6-in-1 combination vaccine. The second is the pneumococcal vaccine, and the third is the rotaviral vaccine, which is given orally. Right. So as I already told you, any vaccine when pricked will give you a pain. The pain will severity and the pain tolerance will vary from child to child. And as I already told you, all these are suppressed form of bacteria and viruses. They will always produce some fever or some irritability in a child, because all these when go inside, they produce a mild form of a disease which is not seen outside. So there will be some irritability in the child after any vaccination, and there will be a pain and a swelling in the area where the vaccine has been given. And in some rare instances, there has been cases of mild form of loose stools after the rotavirus vaccine also. These are the major side effects which a child when given a 6 weeks vaccination. Otherwise, all the 6 weeks vaccination are entirely safe and not giving much side effects when given in the right way.
Hope that will make you better prepared for possible side effects post the vaccination. Our next question comes from Sundari Jain. Sundari says, "Namaste, doctor. My newborn baby will be 6 weeks old next week. What diseases are covered under this vaccination? Will this combination vaccine be as effective in giving immunity to my baby as 6 standalone vaccines would have been?" So, a little recap, doctor, from your end about this.
We'll brush it up again. Thank you. So namaste, Sundari. So your query is pertinent. Like previously, we used to give separate vaccines. Separate vaccines for separate diseases. Diphtheria is separate, pertussis is separate, tetanus, get TT injection is separate, Hib is separate, hepatitis B is separate, polio vaccine is separate. All these are separate. But what happens is this: when given separately, you have to make multiple visits to the doctor, or your child needs multiple pricks into the thigh, which is bit which bit I would say it's not so comfortable for the child. It's not so comfortable for the doctor. It's not so comfortable for the parent too. So the future is going to be combination vaccine. Why combination vaccine? Because all those antigens or all those bacteria viruses are mixed in the same vaccine, which is the 0.5 ml. Lot of research has to be done, because each zero point 0.5 0.5 ml, if you make it, it comes to 3 ml. You cannot inject 3 ml into a child, into the newborn's thigh. So what they have to do is, they have to make this 3 ml again to 0.5 ml, and in the same time they have to maintain the efficacy of the vaccine too. So they have to do lot of groundwork and research, and they have come out with a combination vaccine, which is again the 0.5 ml, which contains all the 6 antigens or the 6 bacteria viruses. So once you give this vaccine, what researchers do, all these lab scientific researchers, they do a non-inferiority study. So this is called as a non-inferiority study. It means that it is not inferior to the already persisting vaccine, or they do a geometric mean titer of the antibodies produced by giving the combination vaccine, giving the standalone vaccine. So if the geometric mean titer of the antibodies are the same, they say that okay, fine, these two, the standalone vaccine and the combination vaccine, gives the same efficacy or the immunogenicity in the child.
Right. Our next question comes in from Mihir, who is joining us from Delhi. Mihir says, my baby is 5 weeks old. Is this one vaccine against 6 diseases available in government hospitals? If yes, then is it equally effective?
See, government hospitals, we still have only five in one vaccine. The IPV, that is the polio vaccine, the included polio vaccine in the component, is not available in the government sector. They have the vaccine for diphtheria, pertussis, tetanus, Hib, and hepatitis B as a combination, and the polio virus vaccine is given separately in a separate thigh. So this is the vaccine which is given in the government sector. And still in the government sector, the wholesale vaccine is being given, because government still sticks on to made in India vaccines. The made in India vaccine as of now is a wholesale vaccine, and the parents should know that the available acellular vaccines in the market, in the private market, are imported vaccines. They are internationally available vaccines which are being imported into India, and the government sector vaccines are the wholesale vaccines.
Right. There's your clarification about whether the same vaccine is available in government hospitals. Our next question is from Seema. Seema says, hello, doctor. My cousin is 34 weeks pregnant currently. Is it better to get this vaccine administered to her now, or should it be administered to the newborn itself? Thanks in advance.
Okay, fine. So the 34 weeks pregnancy, I believe your gynecologist should have advised you a Boostrix vaccine, that is a DPT vaccine, that is the reduced dose diphtheria, acellular pertussis, and a tetanus vaccine somewhere sometime during the pregnancy. And I believe you must have taken it during your pregnancy period. And even if you have given this vaccine, if you have taken this vaccine in the antenatal period, it is mandatory to give the newborn these vaccines as per the schedule, because there is no evidence that you taking one dose of this vaccine is going to protect the child or your newborn for the whole lifetime from all these diseases. So it is mandatory for you. If you have even take, if you have to take this vaccine, that's for sure. But the newborn also, after the birth, has to take the 3 doses of this vaccine as per the schedule.
There you heard it from Dr. Somasundaram. The newborn has to take the vaccine. The mother cannot take the vaccine while pregnant in place of the baby. Doctor, we have another question. Actually, I'm going to combine two questions over here because they are related to the same issue. Our first question is from Pallavi Narang. Pallavi says, hello, doctor. My baby is 7 weeks old now. I missed his vaccination as he was unwell. Is it possible to administer it now? And we have another question coming from Alka, who has joined us from Lucknow. Alka says, my baby is 6 weeks old, 45 days currently, and has high fever currently. Can I give him the vaccine next month, or will that be too late?
Perfect. See, there are instances when because of the inconvenience of the family member or because of some illness in the child, the vaccine may get postponed, or because of some other reason, the vaccines may get postponed. But I would say, whatever may be the date, you should take the vaccines. It is called, we have something called as a catch up vaccination or a catch up schedule. Even if a newborn baby, because of some reasons, because of some prolonged admissions for the child or from prolonged illness in the child, even if it comes at 6 months, doctor, we have missed all those vaccines, it is my duty to give the vaccine, because these are dates when the vaccine can be given at the earliest possible date. Earliest possible, you can give the first dose at 6 weeks, second dose at 10 weeks, and third dose at 14 weeks. And there is a vaccine called as varicella vaccine or the chickenpox vaccine. The earliest possible is 15 months. That is 1 year, 3 months. But if a child comes at 4 years and say, oh, doctor, we have not given the varicella vaccine at all, can I give it to me? Yes, you can take the vaccine. The 15 weeks is the date which the vaccine can be given at the earliest to the child. But fortunately, between 15 months to 4 years, your child has not developed a varicella or chicken pox, and now you are giving the vaccine to protect the future, for the child not to develop the varicella disease or the chickenpox disease in the future. Likewise, in this DPT vaccine or the 6 weeks vaccine also, because of some unfavorable situations in the family or some illness in the child, the vaccine is getting postponed. It is the best date, the next possible date, you have to visit the doctor and you have to take the vaccine. The only exception is the rotavirus vaccine. The first dose of rotavirus vaccine, if it is not given at 32 weeks, you cannot give the vaccine later at all, because rotavirus vaccine, it has to be given at 6 weeks, sorry, not 32 weeks, 14 weeks. If the first dose is not given at 14 weeks, you cannot take the vaccine at all for your child, because 6 weeks, 10 weeks, 14 weeks is the dose of the rotavirus vaccine. If by chance you have missed the 6 weeks, you have missed the 10 weeks, you have even missed the 14 weeks, now your child is 5 months old, you are going to a doctor, the doctor will not give the dose of rotavirus vaccine. The doctor will give only the rest vaccines, that is the 6-in-1 vaccine and the pneumococcal vaccine.
Right. So, Dr. Somasundaram just clarified about the timeline of the vaccines, especially when there is a delay due to any unforeseen circumstances. Doctor, we have a couple of more questions coming in. I'm going to combine the next two questions as well because they are both related to what should be done post vaccination and side effects and the like. So, Sneha, who's joining us from Pune, wants to know, if my child gets a fever after vaccination shots, what should I do to treat them? And we have Ranjita joining us from Ghaziabad, who says, my baby is 6 weeks old. Tomorrow is her vaccination day. I'm very tensed. What will be the side effects of this vaccine? What precautions can I take beforehand so that she doesn't have fever and swelling after the vaccination?
Yeah, thank you. So the thing is, we already spoke. Vaccines are all safe. Vaccines are not going to cause much fever in kids if they are given in the right way. We also discussed that only the wholesale vaccines are 99 percentage, 90 to 99 percentage known to cause fever and swelling. Acellular vaccines, only the pertussis component is known to cause fever among all those vaccines which is being given. But there no disease we can, no vaccine we can say the child will not get a fever. Maybe 1 in 100 or 1 in 1000 may develop a fever. Like 6 weeks vaccine, we already spoke, 90% will not develop a fever if you have taken an acellular vaccine, and if you have taken a wholesale vaccine, you will develop a fever, and the severity will vary from child to child. Precautions, nothing can be done. No, don't give any prophylactic paracetamol or pain reliever or put some gel over that area and all, because they can be allergic to the children. So directly go to the vaccine area or to the pediatrician, make yourself comfortable, give the vaccine to the child, because your pediatrician will give 2 vaccines simultaneously in both the thighs and also a oral drop. He will advise you what dose of paracetamol to be given after the vaccination. Take the dose of paracetamol for the first 24 hours, every 6 hours once, depending upon the weight of the child. Post 24 hours, your child will be comfortable. For the first 24 hours, there will be some mild irritability will be there. The child will be sleeping a lot, or will be more irritable. It means that the vaccine is working in the child. So you should be comfortable that, okay, fine, my child is getting protected for all those 8 diseases, and he will not be a prey for all those 6 infections if they affect him in future.
Right. Thank you for that, doctor. Our next question comes in from Avni, who's joining us from Noida. Avni says, my daughter is 1 month old right now, and she has a lot of rashes on her body. Is it safe to give her the combination vaccine in this scenario?
Hi, RB. So the thing is, so what is the reason for the rash? We should know that. It's a basic, it's like because of any cosmetics or any soaps which you have applied, or any dress which is allergic to the child. So you can find out from the doctor what is the nature of the rash, why this has rashes happen to your child. It is some detergent allergy, or whether it's an exhibition of an internal disease. So I will not be able to know what has caused this rash until I see this rash and get the history from you. So you should consult with your doctor what is the nature of the rash, right? So if this is because of any, not because of any systemic problem, or if this is not because of an internal disease, it is, you can right away, you can tell your doctor about the rash, and then you can go ahead with the vaccination.
Right. Hope that answers your doubt, Avni. Thank you so much for that, doctor. Doctor, before we conclude today, just a recap of this particular one vaccine to protect against 6 diseases. If you could recap and let all the parents who have joined us know what diseases this covers and why is it so important to give this to our newborn.
Sure, Jandra. So the thing is, we spoke from the start about the vaccinations, why vaccines are important for children, and when do we start the vaccination. We spoke about the vaccines which are given in the birth before discharge. That is the BCG for tuberculosis, a polio drop, and a hepatitis B vaccine, which is being followed both in the government sector and the private sector. We spoke about a schedule which is being followed by all the pediatricians in the country. That is the Indian Academy of Pediatrics schedule, which is being followed. The schedule is the same wherever the nook and corner of the country where you go. Here we start the vaccine schedule at 6 weeks, that is 42 days. We protect the kids against 6 diseases, that is diphtheria, pertussis, tetanus, polio, hepatitis B, and Hib, which is brain fever. These 6 diseases are available as a combination vaccine, which is easier to administer. Ease of pricking is less for the children. The number of visits to the doctor are less. This 6-in-1 vaccine usually is given along with the pneumococcal vaccine and the oral rotavirus, which is given as a drop. The 6-in-1 vaccine can be a wholesale vaccine or the acellular vaccine as per the preference of the parent, and the availability as per the availability with the doctor. So a wholesale vaccine, as I already told you, is the pertussis component one, is the one which differentiate between a painful vaccine and the painless vaccine. Rest of the 5 components are the same in both the vaccines. It is only few of the antigens in the cell wall which is being knocked out in the acellular vaccine by various technologies, which makes this vaccine less painful, less with less swelling and no fever or less fever. That's the peculiarity of this acellular vaccine. And vaccines has to be given as per the schedule. If for any reason you have not taken the vaccine as per the schedule, you have to take it at the earliest date. So this is the carry home message or the concise of what we have discussed, Chandra.
Right. Thank you so much once again, Dr. Somasundaram, for joining us on this Parentune Live today. I think you've answered all the doubts and queries new parents have related to vaccinations in general and the one vaccine to protect against 6 diseases in particular. Uh, Take care and do stay tuned to the next Parentune Live.
Thank you for this opportunity, and thank you all the parents who have joined live with us. Thank you, Parent Tune.